So after knowing about how to diagnose diabetes or how to and when to screen for diabetes, and after knowing about the implications of poor lifestyle, particularly sugar sweetened beverages, we now come to what should we eat in diabetes. So there are many questions which come in mind of patient that what to eat and what not to eat. So I'll take these questions one by one. First of all, can a diabetic person take same kind of food as his or her family member? The answer to this question is yes, of course, he can take same kind of food. So foods are not different for diabetic patients than non-diabetic patients. They are one and the same. Just the quantity of food changes and sometimes the way you cook it also changes. So for a diabetic patient, energy balance is very much prudent to management of type 2 diabetes. Eating right kind of food in right quantity will help manage your blood glucose. It has been seen that if you are taking the prescribed calorie which has been prescribed by you by a registered dietitian and your endocrinologist, then it has been seen that the 3-month average HbA1c can come down only with the help of diet to an extent of around 0.7 to 0.8, which is equal to the HbA1c which get reduced with many costly alternative medications of diabetes. So this is the implication of choosing a right diet for you. The calorie standard has to be maintained, the proportion size has to be maintained for food which are rich in carbohydrate, particularly rice, particularly foods which are rich in carbohydrate like chapatis, like potatoes. Apart from these, there are some free foods. What are free foods? Free foods are foods which can be more or less taken in any amount which the patient want to consume because they have very less calorie in it, like green leafy vegetables, like some fruits like apple, guava, orange. These are watermelon. These are fruits which are having very less glycemic index and less calorie density, and therefore they can be taken in free amount. Dal, pulses, if the patient is not having any imperative chronic kidney disease, then patient can take dal, sprouts, green leafy vegetable in any amount, milk, curd in any amount which the patient thinks or which the patient feels like. Apart from this, patients can also take nuts like almonds in any amount. So these are the important issues with diet. Then another question which comes in mind of patient is timing. So when he should take his food? The answer is if the patient is on drugs like sulfonylurea or patient is on insulin, then the meal time should be maintained more or less constant. However, if the patient is not on insulin or sulfonylureas, then timing of meal can be more flexible. At least 3 servings of fruits and 3 servings of green leafy vegetable should be taken by a diabetic patient per day. Apart from that, the oil, another question which very commonly comes in mind of patient, that which oil should be used for cooking. So basically there is no one oil which can be used or which should be used always. Rather, the various oils with various component should be used alternatively. Oils which are rich in monounsaturated fatty acids like olive oil, canola oil, oils which are rich in polyunsaturated fatty acid like sunflower oil, safflower oil, rice bran oil, all of these oil including mustard oil should be used one at a time, or it should be used with different foods at same point of time. For example, in a family, it can be done that one particular thing is being cooked in mustard oil, another food item is being cooked in rice bran oil. In that case, the family itself or the patient or in living with the family is getting the good component of all the oils, whether it's mustard oil or rice bran oil or olive oil at one point of time or in what cross section of time only.